Hello everybody, welcome back to my channel. So today I am back with a very interesting video, and I feel like this will be very beneficial to a lot of you guys out there, whether you are a new dental professional or a patient or just a browser, or you're just interested in the dental field. So today my video will be about different types of dental cleaning. I know a lot of you guys go to dental office to get your cleanings done, and sometimes you just get lost because we talk about something different than a regular cleaning. And obviously you have to understand that the different types of cleaning come because we take x-rays, we do the gum measurements, and we also do the dentist exam, and it's all based on those exams. I thought about making this video because as a dental professional, I see a lot of my patients getting confused when I talk about different types of cleaning than just a regular cleaning. There are many cleanings out there, and I thought this will be very much needed just because we all need a dental basic knowledge. So let's go ahead and get started. Alright, so today I'll be using this patient consultation guide from Crest and Oral-B as a professional oral health, guidance. I got this a long time ago when I was in dental school, and here it is finally. It is being used. So let's get started. So here is the classification of periodontal and peri-implant disease guidance. So whenever we look at this, you will be lost because you don't have any background, but this will be just a reference of what I can just show you. Whenever we look at this chart, we're gonna go ahead and focus on the gingival health and gingivitis, and then also periodontitis. I feel like gingivitis is more commonly known to a lot of you guys, and this is what we reference the beginning of the gum disease. Then whenever they stay too long, it affects the bone, and that's when it is referencing to the periodontitis. Let's go ahead and get started with the healthy mouth. And this is obviously when we do just regular cleaning because everything is healthy. When we look at your gum, the gum is nice and tight around each tooth, and it should be nice and pink colored without any bleeding. And maybe we can spot a couple bleedings here and there, but it shouldn't be everywhere. And you might be familiar with this instrument that we use. This is called probe, and it has indicators that we reference to, and each one is a millimeter. And whenever we measure your gums for a healthy mouth, it should be 1 to 3 millimeters without any bleeding, or just maybe 1 or 2 bleeding spots. And now let's go ahead and move on to the next stage, which is gingivitis. And this is the initial stage of gingivitis, the gum disease. So it also has like mild gingivitis or advanced gingivitis, severe gingivitis, stuff like that. But gingivitis normally means there is gum swelling and bleeding gums. If you look at this picture over here, then you can tell the gum is very red and it's inflamed. And over here, there is gum swelling. And this happens because there is plaque happening on your gum and then around the gum line. It can happen because we miss brushing the gum lines and we're not flossing every day. Then the gum measurements over here, it will still be 1 to 3 millimeters, and there might be a couple 4 millimeter pockets, but obviously it's happening because the gums are swollen. And whenever this happens, you're going to be seeing a lot of bleeding whenever you brush or floss, and even when we measure your gums. And it will be a little bit uncomfortable when we do everything. So that is the initial part of it. And I would typically do gingivitis cleaning on a patient if it's pretty advanced, not just like, localized gingivitis, it's not everywhere, or the bleeding doesn't happen as much. But then advanced gingivitis is something that's all throughout the mouth and it's bleeding everywhere, and then the gum doesn't look good at all. Like it's very red and like purplish almost. Then I recommend my patients to get gingivitis cleaning along with laser therapy. Laser is something that kills the bed bacteria underneath the gum while it shoots the lasers out, and it reconstructs the tissue, so it should be very helpful. But at least we have to do the home care better. And after the gingivitis cleaning, I will recommend at least like 4-month recare just for the next visit, because the gum needs extra help. And one thing that I forgot to mention is that gingivitis is something that's reversible to healthy side, because it's only affecting the gums. If we do everyday brushing and flossing every night, then gingivitis can be reversed to a healthy mouth. Let's go ahead and move to periodontitis, and this is the initial stage of periodontitis. So the difference between periodontitis and then the gingivitis is that gingivitis is only affecting the gum, and periodontitis started to affect the bones. So if you can see over here, the bone on this side is nice and good, but then the other side it is infected, and then a little bit of is missing. Bone has defect. Whenever we measure your gums, we're gonna be seeing, some 4s, a lot of 4s actually, and even some 5s too. But there is a tartar buildup happening underneath the gum, and the tartars should be normally about like right here, and that's why the bone is trying to run away from the tartar. Our bone is normally made all healthy, right? But whenever the tartar happens underneath the gum, then that's when the bone wants to run away from the foreign object and want to remain its position. So that's the reason why the bone is going down, and this is the stage when we can do like localized deep cleaning based on the tartar and then based on the gum measurements. We have to decide, but at this stage you'll be still bleeding a lot, but you might not feel the pain as much as compared to the other stages of periodontitis. And let's go ahead and move on to the next one. And over here we're seeing stage 2 periodontitis, and whenever we measure your gum, you're going to be seeing a lot of 5 millimeters and maybe a couple 6s too. And then all these yellow stuff is tartars that's happening around the gum and underneath the gum. And again, the bone is even more below than the other one. At this stage, you'll be feeling some sensitivities on your teeth because the gum has recessed a little bit. And the reason why you're feeling sensitive is we call the top of your tooth portion a crown, and then the root is remain underneath the gum. This is the root area, and the gum is supposed to be up here, but whenever it goes down a little bit of your root portion is showing, and that's why you're feeling sensitive, because it's missing enamel. And then enamel is the most strong structure of our tooth, but when it's missing, you're going to be feeling some sensations. And around stage 2, you might be feeling just a little bit of mobility here and there. Mostly it shouldn't be too much of mobility. And then let's go ahead and move to stage 3 periodontitis, and this is when we see 6 millimeter pockets, and the bone level is below than where it should be, obviously. And then see how the spikiness, the tartar is existing underneath the gum. And typically in the x-rays, you will not see the gum level because it's not dense enough, but our teeth and our bone and then the tartar is hard and very dense, so you can see everything. Around this stage, you'll be feeling, more pain. And then of course there's a lot of bleeding happening. And at this stage, you'll be feeling some furcation involvement. Furcation is referencing to in between space of your roots. This is one tooth, and then there are like 2 roots that's showing right here, but in between the space of it, we call this furcation, and then we can differentiate whether it's furcation 1, 2, 3, and stuff like that. At this stage, you'll be feeling more sensitivity here, and then a little bit more mobility, and then you can also lose your teeth as well. It could be just 1 or 2 teeth at a time. But when we move to stage 4, this is when we see a huge chunk of bone loss. Of course, if you see this x-ray right here, then the bone is very, very much below than where it should be. At this stage, the teeth will be pretty mobile, and a lot of patients come in at this stage because it's very, very painful. The gum disease can be pretty silent. If there's a severe defect like this, then it's giving us a lot of pain, and then some patients might lose a lot of teeth because of the bone defect. And at this stage, we're seeing any numbers from 6 millimeters to 7, 8, 9, 10, 11, a lot of upper numbers. So that's not good. And when a new patient comes in at this stage, we normally refer this patient to a perio office. It's a specialist office. They do a lot of bone graft and then deeper cleaning, and then they even do surgery to flap the gums and then clean it out, or they just extract a tooth and then replace with bone graft and then an implant at the end. So that's another story, but those are the stages of periodontitis. And also not only staging, but there are also grading system. Grading system is based on our health, whether you are a smoker or not, whether you have diabetes or not. And at the periodontitis stage, nothing is reversible to healthy side. So that's why we want to prevent these incidents to happen by taking care of our gums at this stage. I just want to give you guys information about the staging basically, and then the difference between periodontitis and then gingivitis. And normally that's the reason why we can decide whether you need a just regular healthy cleaning, or gingivitis cleaning, or localized deep cleaning, or full mouth deep cleaning based on your gum condition. Well, I hope you guys found this video very helpful and informative. I know it's a lot of information, but we do need to understand the different types of stages of our gum health. Hope you guys understood everything, and if you guys have any questions, just comment below, and thank you guys for watching.